Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Catheter ablation or antiarrhythmic drugs for ventricular tachycardia. Background. Patients with ventricular tachycardia and ischemic cardiomyopathy are at high risk for adverse outcomes. Catheter ablation is commonly used when antiarrhythmic drugs do not suppress ventricular tachycardia. Whether catheter ablation is more effective than antiarrhythmic drugs as a first-line therapy in patients with ventricular tachycardia is uncertain. Among patients with ischemic cardiomyopathy and ventricular tachycardia, an initial strategy of catheter ablation led to a lower risk of a composite primary endpoint event than antiarrhythmic drug therapy. Fixed-duration Acalabrutinib combinations in untreated chronic lymphocytic leukemia. Background. Whether fixed-duration Acalabrutinib venetoclax, with or without obinutuzumab, would result in better progression-free survival than chemoimmunotherapy in patients with untreated chronic lymphocytic leukemia, CLL, is unknown. Conclusions. Acalabrutinib venetoclax with or without obinutuzumab significantly prolonged progression-free survival, as compared with chemoimmunotherapy in fit patients with previously untreated CLL. Microvascular inflammation of kidney allografts and clinical outcomes. Background. The heterogeneous clinical presentation of graft microvascular inflammation poses a major challenge to successful kidney transplantation. The effect of microvascular inflammation on allograft outcomes is unclear. See conclusions. Microvascular inflammation in kidney allografts includes distinct phenotypes, with various disease progression and allograft outcomes. Our findings support the clinical use of additional rejection phenotypes to standardize diagnostics for kidney allografts. Long-term effects of Empagliflozin in patients with chronic kidney disease. Background. In the EMPA-Kidney trial, Empagliflozin, a sodium glucose cotransporter 2, SGLT2, inhibitor, had positive cardiorenal effects in patients with chronic kidney disease who were at risk for disease progression. Post-trial follow-up was designed to assess how the effects of Empagliflozin would evolve after the discontinuation of the trial drug. See inclusions. In a broad range of patients with chronic kidney disease at risk for progression, Empagliflozin continued to have additional cardiorenal benefits for up to 12 months after it was discontinued. Next, we will be discussing articles from Journal of American Medical Association. Emergency Clinician Buprenorphine Initiation, Subsequent Prescriptions, and Continuous Prescriptions. Question. How did California Emergency Clinician Buprenorphine Initiation and Subsequent Prescriptions change from 2017 to 2022? Findings. In this retrospective observational study, 345,024 patients filled 3.8 million buprenorphine prescriptions in California. Emergency clinicians increased from 2% to 16% of buprenorphine prescribers, and their buprenorphine initiation increased from 0.1% to 5% of initiations. The ratio of initiation prescriptions to second prescriptions within 40 days was 2.8. The ratio of initiation prescriptions to 180 days or more of continuous prescriptions within 1 year was 9.1. Meaning from 2017 to 2022, California emergency clinicians increasingly adopted buprenorphine prescribing for opioid use disorder, with approximately 1 in 3 patients going on to receive a second prescription, and approximately 1 in 9 patients going on to receive continuous prescriptions. Illicit substance use and treatment access among adults experiencing homelessness. Question. What is the prevalence of illicit substance use, treatment, non-fatal overdose, and naloxone possession among adults experiencing homelessness in California. Findings. In this multi-staged probability-based survey of 3,200 adults experiencing homelessness in California from October 2021 to November 2022, an estimated 37% reported using any illicit substance regularly, greater than or equal to 3 times per week in the last 6 months. Methamphetamine use, 33%, was the most common. Of those who reported regular use, an estimated 21% wanted, but were unable, to receive treatment. Approximately 20% of participants reported a non-fatal overdose and 25% reported being in possession of naloxone, meaning substance use and non-fatal overdose was common among people experiencing homelessness in California. There was high unmet need for substance use treatment and naloxone. Next, we will be discussing articles from Annals of Internal Medicine. Effects of noise and public setting on blood pressure readings, a randomized crossover trial. Background. Guidelines emphasize quiet settings for blood pressure, BP, measurement. Conclusion. The BP readings obtained in public spaces were minimally different from BPs obtained in a private office, suggesting that public spaces are reasonable settings to screen for hypertension. The association of Epstein-Barr virus donor and recipient Serostatus with outcomes after kidney transplantation. A retrospective cohort study. Background. Prior studies indicate that 1% to 4% of Epstein-Barr virus, EBV seronegative recipients of EBV seropositive donor, EBVD+/R-, kidneys develop post-transplant lymphoproliferative disorder, PTLD. However, these estimates are based on limited data that lack granularity. Conclusion. Compared with previous studies, this study showed that EBVD+/R- kidney recipients face a 5 to 10-fold higher cumulative incidence of PTLD. Strategies to mitigate the PTLD risk are urgently needed. Next, we will be discussing articles from British Medical Journal Stroke and Myocardial Infarction with Contemporary Hormonal Contraception. Real-world, nationwide, prospective cohort study. Objective to evaluate the association between contemporary hormonal contraceptive use and the risk of incident ischemic stroke and myocardial infarction. Conclusions. Use of contemporary estrogen, progestin, and progestin-only contraceptives was associated with an increased risk of ischemic stroke and, in some cases, myocardial infarction except for the levonorgestrel-releasing intrauterine device, which was not associated with either. Although absolute risks were low, clinicians should include the potential risk of arterial thrombosis in their assessment of the benefits and risks when prescribing a hormonal contraceptive method. Next, we will be discussing articles from Lancet. Epidemiological and clinical features of Mpox during the clade-IB outbreak in South Kivu, Democratic Republic of the Congo. A prospective cohort study. Background. Clade-IB, a new strain of clade-I monkeypox virus, emerged in Eastern Democratic Republic of the Congo, sparking an international outbreak. Comprehensive studies are needed to assess its transmission dynamics and clinical presentation. Interpretation. Clade-IB infections in Kamituga showed distinct clinical patterns compared with clade-IA outbreaks elsewhere in the country and the global clade-IIB outbreak. In adults, the disease primarily affected the genitourinary system, compatible with sexual transmission, whereas children mostly manifested extragenital lesions. These findings highlight the need for updated case definitions and targeted public health interventions to address evolving transmission dynamics and mitigate risks for vulnerable groups, including pregnant women and young children. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology, https://ascopubs.org/toc/goc/current. Here are the articles from Journal of Hepatology. Identifying the optimal measurement timing and hemodynamic targets of portal pressure gradient after TIPs in patients with cirrhosis and variceal bleeding. PPG obtained immediately after TIPS was not representative of the PPG values measured later. PPG values obtained more than 24 hours after TIPS accurately predicted risks of portal hypertension complications and hepatic encephalopathy. An early PPG of 11 to 14 millimeters of mercury, or a 20% to 50% relative reduction from pre-TIPS baseline, appeared to be the optimal target. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Safety and tolerability of CP101, a full-spectrum, oral microbiome therapeutic for the prevention of recurrent Clostridioides difficile infection, a Phase 2 randomized controlled trial. Background and aims. Recurrent Clostridioides difficile infections, CDIs, remain common. While novel microbiome therapeutics gain approval, the efficacy of a full-spectrum, oral microbiome therapeutic is unknown. This study aimed to determine the safety and efficacy of CP101, an orally administered microbiome therapeutic, to restore a diverse microbiome and prevent recurrent CDI in a broad population to conclusions. CP101 was superior to placebo in reducing recurrent CDI with a safety profile similar to placebo. Here are the articles from Clinical Gastroenterology. Prevalence and predictors of follow-up endoscopic biopsy in patients with celiac disease in the United States. Objective: to characterize the frequency and predictors of follow-up endoscopic biopsy in patients with celiac disease. Background: the utility of routine follow-up biopsy in patients after a diagnosis of celiac disease is uncertain, especially in patients whose symptoms resolve on the gluten-free diet. Conclusions: follow-up duodenal biopsy is performed in a substantial minority of U.S. patients with celiac disease. Adult age and increased comorbidity burden were associated with a greater likelihood of follow-up biopsy. Just under half of follow-up biopsies are performed for routine surveillance, in the absence of persistent symptoms. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Punch CD3-OLS, a Phase 3 prospective observational cohort study to evaluate the safety and efficacy of fecal microbiota, live JSLM, rebiota, in adults with recurrent Clostridioides difficile infection. Background: the aim of this study was to evaluate the safety and efficacy of fecal microbiota, live JSLM, RBL, rebiota, the first single dose. Broad consortia microbiota-based live biotherapeutic approved by the U.S. Food and Drug Administration for preventing recurrent Clostridioides difficile infection, RCD, in adults following standard of care, SOC, antibiotic treatment. RBL was safe and efficacious in participants with ERCD and common comorbidities. This is the largest microbiota-based live biotherapeutic study to date, and findings support use of RBL to prevent RCD in a broad patient population. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Arthritis and Rheumatology. Clinical presentation and course of pulmonary involvement in chronic non-bacterial osteomyelitis. Objective: pulmonary involvement in chronic non-bacterial osteomyelitis, CNO, is rare. Limited awareness results in diagnostic challenges, especially because malignancy or infection needs to be considered. Conclusion: PCNO is usually asymptomatic. Although more common in girls and patients with multifocal CNO, PCNO is not associated with systemic parameters of inflammation or specific organ involvement. Prognosis of PCNO is favorable, and most lesions resolve over time. Thus, a careful watch and wait strategy may be appropriate. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Conduction disturbances and outcome after surgical aortic valve replacement in patients with bicuspid and tricuspid aortic stenosis. This is the first study to investigate the incidence and prognostic relevance of new-onset cardiac conduction disturbances, After surgical aortic valve replacement separately in bicuspid and tricuspid aortic valve patients with aortic stenosis. Despite the younger age and lower prevalence of cardiovascular risk factors, bicuspid aortic valve aortic stenosis patients had a markedly elevated risk of permanent pacemaker implantation and new-onset left bundle branch block compared with tricuspid aortic valve aortic stenosis patients. In particular, bicuspid aortic valve aortic stenosis patients with fusion of the right and non-coronary cusps, new-onset left bundle branch block after surgical aortic valve replacement, was associated with an increased all-cause mortality during follow-up. What are the clinical implications? The findings of this study underscore the potential benefit of a preoperative cardiac multidetector computed tomography for determination of aortic valve morphology to optimize risk assessment and patient management. Because of the prognostic relevance of new-onset left bundle branch block after surgical aortic valve replacement, close monitoring of these patients might be necessary to prevent serious complications during follow-up. Here are the articles from Journals of the American College of Cardiology. Accelerometer measured sedentary behavior and risk of future cardiovascular disease. Background. Beyond serving as a marker for insufficient physical activity, sedentary behavior may directly affect future cardiovascular (CV) disease risk. Objectives. This study sought to examine associations between accelerometer measured sedentary behavior with risk of specific CV outcomes, including potential relations with moderate to vigorous physical activity, MVPA. Conclusions. Sedentary behavior is broadly associated with future adverse CV outcomes, with particularly prominent effects on HF and CV mortality, where risk inflected at approximately 10.6 hours/d. Although guideline-adherent MVPA partially mitigates excess risk, optimizing sedentary behavior appears to be important even among physically active individuals. Coronary revascularization guided with fractional flow reserve or instantaneous wave-free ratio. A 5-year follow-up of the DEFINE-FLARE randomized clinical trial. Question. Is an instantaneous wave-free ratio, IFR-based strategy to guide revascularization in patients with coronary artery disease comparable with fractional flow reserve, FFR, in terms of long-term cardiovascular outcomes? Findings. In the 5-year follow-up of the DEFINE-FLARE randomized clinical trial, no significant differences in major adverse cardiac events were observed between the IFR and FFR study groups, 21.1% versus 18.4%, respectively. However, higher mortality was observed in the IFR study arm that was uncoupled with other study endpoints, meaning in this study, IFR was comparable with FFR in terms of major adverse cardiac events in long-term follow-up. Next we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Gut microbial changes associated with obesity in youth with type 1 diabetes. Context. Obesity is prevalent in type 1 diabetes, T1D, and is problematic with higher risk for diabetes complications. It is unknown to what extent gut microbiome changes are associated with obesity and T1D. Objective. This work aimed to describe the gut microbiome and microbial metabolite changes associated with obesity in T1D. We hypothesize statistically significant gut microbial and metabolite differences in lean T1D youth, body mass index, BMI, 5% less than 85%, versus those with obesity, BMI, greater than or equal to 95%. Conclusion. Our findings identify a gut microbiome and microbial metabolite signature associated with obesity in T1D. These findings could help identify gut microbiome targeted therapies to manage obesity in T1D. Here are the articles from Diabetes Care. Intensive glucose lowering and its effects on vascular events and death according to age at diagnosis and duration of diabetes. The ADVANCE trial. Objective. To compare the vascular effects of pursuing more versus less glucose lowering in patients with younger or older age at diabetes diagnosis, and with shorter or longer diabetes duration. Conclusions. Intensive glucose lowering may be recommended irrespective of age at diagnosis or diabetes duration. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Effects of COVID-19 infection on symptom severity and disability in multiple sclerosis. Background and objectives. Infections, including infection with SARS-CoV-2, COVID-19, could alter the course of multiple sclerosis, MS. Previous studies assessing the effects of COVID-19 on MS outcomes were small and had discordant findings. The study objective was to evaluate the association of COVID-19 infection with changes in the trajectory of MS symptoms and disability discussion. Our study using an ITS design found that COVID-19 infection was not associated with immediate changes in symptom severity or disability, nor did it change the trajectories of these outcomes over a median follow-up of 18 months. Although results may not generalize to younger people with MS, these findings enhance our general understanding of the consequences of infection in people with MS. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Longitudinal changes in maximal forced inspiratory flow and clinical outcomes in patients with COPD background. COPD primarily impairs expiratory flow due to progressive airflow obstruction and reduced lung elasticity. Increasing evidence underlines the importance of inspiratory flow as a biomarker for selecting inhaler devices and providing ancillary aerodynamic information. Research question. Do the longitudinal changes in maximum forced inspiratory flow, FIFMX, influence acute exacerbations and lung function decline in patients with COPD? Interpretation. This study showed that the longitudinal changes in FIFMA are associated with clinical outcomes in patients with COPD. Patients with increased FIFMX experienced a lower rate of severe exacerbations and a slower decline in lung function. These findings suggest the potential benefits of optimizing inspiratory flow in COPD management, although further studies are needed to confirm these observations due to potential confounding factors. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Serum immunoglobulin G levels are associated with risk for exacerbations. An analysis of spiromics. Rationale. Serum egg deficiency is associated with morbidity in chronic obstructive pulmonary disease, COPD, but it is unclear whether concentrations in the lower end of the normal range still confer risk. Objectives. To determine if levels above traditional cutoffs for serum Ag deficiency are associated with exacerbations among current and former smokers with or at risk for COPD. Conclusions. Lower serum Ag is prospectively associated with exacerbations in individuals with or at risk for COPD. Among subclasses, lower IG1 and IG2 are prospectively associated with severe exacerbations. The optimal EG cutoff was substantially higher than traditional cutoffs for deficiency, suggesting that subtle impairment of humoral immunity may be associated with exacerbations. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Humidified non-invasive ventilation versus high-flow therapy to prevent reintubation in patients with obesity, a randomized clinical trial. Rationale. The optimal strategy to prevent reintubation in patients with obesity remains uncertain. Objectives. We aimed to determine whether non-invasive ventilation, NIV, with active humidification is superior to a high-flow nasal cannula, HFNC, in preventing reintubation in patients with obesity at intermediate risk. Conclusions. Among adult critically ill patients with obesity at intermediate risk for extubation failure, the rate of reintubation was not significantly lower with NIV than with HFNC. Nevertheless, there is a risk for underpowered results. Here are the articles from Kidney International Reports. Randomized trial of dietary acid reduction and acid-base status of patients with CKD and normal estimated GFR. Introduction. Modern acid-producing diets in patients with stage G3 to G5 chronic kidney disease, CKD, can cause severe acid accumulation with metabolic acidosis, and less severe accumulation causing eubicarbonatemic acidosis, in stages G2 to G3, each with kidney injury. The impact of these diets on acid accumulation in those with CKD but normal estimated glomerular filtration rate, EAG-OFF-E, CKD G1, is unclear. Dietary acid reduction reduces acid accumulation and kidney injury in patients with CKD and normal eGFR. CKD in Bardet-Biedl syndrome. Evidence supporting multifactorial etiology. Introduction. Chronic kidney disease, CKD, is a critical prognostic factor in Bardet-Biedl syndrome, BBS. Early diagnosis and intervention are essential for improving patient outcomes. The present study analyzed kidney function in patients with BBS, with the aim to explore the impact of genetic variants and common risk factors for kidney disease. SATS conclusion. The present study suggests that BBS is a condition of vulnerability to develop kidney disease, and that age, hypertension, and obesity are associated with eGFR decline in adult patients with BBS. Whether effective interventions to treat modifiable factors will reduce CKD risk requires further studies.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.